There are two modes of pressure settings Suprasorb CNP P3 offers: continuous pressure therapy and intermittent pressure therapy. Continuous pressure therapy offers continuous operation with constant pressure. It is the default setting of the device. The recommended pressure is -80 mmHg. The pressure range of Suprasorb CNP P3 is from -20 mm of mercury to -200 mm of mercury. Intermittent pressure therapy offers preset variable pressures. The user may specify the minimum and maximum pressure ranges, as well as the duration of respective pressures. Negative pressure setting maximum is -60 to -80 mm of mercury, while the minimum pressure setting is -20 to -40 mm of mercury. The pressure increases and decreases gradually with time interval of 2 to 5 minutes. This feature makes the treatment less painful for the patient. These are some of the guidelines in using Suprasorb CNP P3 negative pressure wound therapy. Start with 48 hours of continuous therapy. Then switch to intermittent therapy to increase the effectiveness of the type of therapy. In the first 24 hours, the therapy must never be interrupted for more than 2 hours continuously. If the therapy is interrupted for longer than 2 hours, the dressing must be changed before it can be restarted to avoid peri-wound maceration. Continuous therapy is suitable for these cases to keep the wound closed. 1. Patients who find intermittent therapy very painful. 2. Patients with symptoms of intolerance. 3. Wounds that are very difficult to seal. 4. Wounds with tunneling or undermining, and wounds with pocket formation. 5. Wounds with considerable amounts of exudate. If a large amount of exudate is removed in the first 48 hours, continue with continuous therapy until the exudate level has gone down. 6. Tissue transplants, grafts, or surgical flaps. Risk of shear forces or dislocation. A reduction in negative pressure to -40 mm of mercury is recommended for 1. Patients with poor nutritional status. 2. Very young or very old patients. 3. Severe pain refractory to analgesia. 4. Increased bleeding tendency. 5. Poor perfusion. 6. Excessive formation of granulation tissue. An increase in negative pressure up to maximum -200 mm of mercury in exceptional cases may be considered if 1. Very high levels of exudate. In this case, it is essential to check the exudate collection area regularly. 2. High volume wounds. 3. Wounds with extensive pockets or tunneled areas. 4. Wound areas where sealing is problematic. On extremities, the use of easy dress is recommended.